Hey guys, what's up? It's me, Professor D. The question I have for you guys today, the NCLEX question, is actually regarding legalities. Ethics and legalities, very important. You're going to get those types of questions on NCLEX. So you have to understand the material and how to answer the question. So I'll just jump into it. The question states, which of the following patients would be of most concern and cause for a lawsuit? 1. A 45-year-old patient with type 2 diabetes. 2. 60-year-old patient with a stage 4 decubitus ulcer. 3. A 40-year-old obese patient with hypertension. Or 4. An 80-year-old patient with bruises on the arms. And I'm going to ask that question again. Oh, excuse me, guys. Which of the following patients would be of most concern and cause for a lawsuit? 1. A 45-year-old patient with type 2 diabetes. 2. A 60-year-old patient with stage 4 decubitus ulcer. 3. 40-year-old obese patient with hypertension. And 4. An 80-year-old patient with bruises on the arms. And I know as students, many of you guys would want to choose 4, the bruises on the arms, but the correct answer is 3, and let me tell you why. The decubitus ulcer that got to a stage 4, that means that pressure ulcer started at a 1 where the skin was not being broken down, but guess what? It was pink and non-blanchable, and not one single nurse caught that. But yet you guys are changing those patients every day. You guys are doing assessments and you never saw that, right? So now it turns into a stage 2 where that skin is actually, the integrity of the skin is broken. Nobody caught that. Nobody addressed it. Then it turns into a stage 3 where not only the skin is open, the skin integrity is diminished. Now it's past the sub-Q layer. No one still hasn't caught it. So now this bad boy is in stage 4 down to the bone. Guess what? That's bad nursing care. Everyone that's been caring for that patient, everyone that's been documenting at the end of the shift that the patient was just fine, blah, 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 each and every one of you will be subject before the Board of Nursing to get your license taken away, okay? And the family of that patient, yes, they have every right to bring a lawsuit personally against you and against the institution that you're working for. Okay, that's bad nursing. Let me tell you why number 4 was not the answer. But I know you were thinking, oh my gosh, this is an elderly patient with bruises on the arms, abuse. But something you need to keep in mind, the elderly, their skin's very what? Very thin. It's paper thin, okay? Their skin's paper thin, and they tend to, many of them tend to bruise easily because a lot of them have had heart issues, which means they're on anticoagulants such as Coumadin. So they tend to bruise easily. So if you have to choose between the patient that bruises easily and the patient that has an ulcer, that's not 1, not stage 2, not stage 3, that got all the way to stage 4, there's no excuse for that. That is neglect. You neglected to assess that patient correctly. You neglected to care for that wound. You neglected to even inform the doctor that there was a wound. You neglected to address it. Okay, so that's why that was the correct answer. Stay tuned. Please make sure you guys check out my website for more videos. nexusnursinginstitute.com. Thanks.